Welcome to Cow Talks. I'm Chris Pravat, Beef Cattle and Forage Commodity Director for the Alabama Farmers Federation.
And I am Marcelo Valau, Forage Extension Specialist with the University of Florida.
And this is our podcast, where we dive deep into the main topics affecting livestock and forage production in the southeastern United States.
From the mainstream media to new technologies straight from our research stations.
From cattle prices to international trade.
From our pastures and beyond.
Join us on this journey as we tackle the main issues affecting our producers and the sustainability of our production systems.
Welcome to Cow Talks. I am Marcelo Valau, Forage Extension Specialist and Associate Program Leader at the University of Florida, and your host. And today with me, co-hosting, is my PhD student, Miranda Emery. Thanks for coming, Miranda.
Pleasure to be here.
Our guest today is Dr. Juan Campos. He is a wildlife extension veterinarian and clinical assistant professor with the University of Florida, with a double appointment with the Department of Large Animal Clinical Sciences and the Department of Wildlife Ecology and Conservation. His work focuses on identifying common pathogens in captive wild-tailed deer, developing fast field diagnosis for diseases like the epizootic hemorrhagic disease, EHD, and the bluetongue virus, BT, and building predictive tools to help us better manage diseases and disease risk through environmental data. He also leads an impactful outreach efforts with the Cervidae Health Research Initiative, CHeRI, helping producers across Florida to improve herd health management and biosecurity. Welcome to Cow Talks.
Thank you very much. Pleasure to be here.
See that Cow Talks is getting very diversified. We've been talking about deer, we've been talking about integrated systems, we talked about viruses, and there's more stuff coming up. So I appreciate you joining us. Dr. Campos, what is the Cervidae Health Initiative?
The Cervidae Health Research Initiative, it's like it says, an initiative, but it's really a program to be able to better understand diseases in the cervidae, which is our deer, right? This initiative started because there was a big outbreak of epizootic hemorrhagic disease, which is a viral disease that is very deadly for white-tailed deer. Around 2012, because of that, deer farming industry here in Florida, for people that maybe are hearing and don't have a clue that there are lots of deer farms, there are lots of deer farms in Florida. Florida is ranked around number 6 in the country in deer farms. And so there was a big concern to learn what was killing, how that can be prevented. So they went to the Florida legislators, and through them, the CHeRI initiative was created, and it came to UF. And through that, CHeRI is an interdisciplinary team of professionals that we started working towards finding out what diseases affects deer and trying to bring health to the herds of the producers here in Florida. And believe it or not, our work has expanded throughout the country as well, because there are lots of deer farmers throughout the United States.
What is specifically your role as a veterinarian within the CHeRI group?
Yes, well, my role, I'm in charge of we call them the necropsy team. So one of the unique thing that CHeRI provides here in Florida, and I say unique because it's really important, and it provides a lot of data, and I think is the key to this project, is that any deer farmer or any farmer that has deer here in Florida, if they happen to have a sick animal, an animal that dies, they can give us a call, and we will go out to their farm and collect diagnostic sample, carry out a field necropsy, collect samples for diagnostics, and run those and give them the results. In a very high percentage, we can tell them what killed that deer. And in some cases, we can't, but that's where our research programs come in to investigate and clarify that.
I'm interested on the outbreak. So we had an outbreak of EHD in 2012, which started the effort for the Cervidae Health Research Initiative. And from what I understand, there's two avenues that we're working on. One is to understand the biology of the disease, the ecology of the disease, and the other one is to implement the surveillance, right? What were the first steps in here? How this process evolved? How are we understanding it, and how it led to this surveillance?
Yeah, when CHeRI started, it was like, CHeRI is, like I said, a unique program. There are very few like it. And it was, nobody really knew exactly, we didn't know exactly what was out there, what was really killing the deer. Because, you see an animal that's sick and dies, you say, oh, this is what killed it, right? So in many occasions, we were sampling the animals and we were realizing that it wasn't EHD, it was a bacterial infection, or it was trauma. So there were different causes of death. It wasn't all EHD or bluetongue. And the more we started working on it, the better we were understanding the, like you said, disease ecology. So in the beginning, we didn't know if there was a seasonality, if outbreaks occurred every year, where in Florida, how often. We didn't know what serotypes we have, because epizootic hemorrhagic disease has 3 different serotypes, where bluetongue in the world has 26. Here in Florida, there's, I believe, if I remember correctly, because it changes all the time, I believe there's 5 confirms, and I think 3 that are not very common, but it varies a lot. So we really were in the dark. And to answer your question, by slowly gaining more data, we were able to fine-tune our efforts. So, for example, in the beginning, okay, we need to find out, what's killing the animal. Once we found out what was killing the animal, okay, what type of bacteria do we have to worry about and which viruses? And then when we found the viruses, we said, okay, what serotypes are they? So we started working on that. And then now we're finding out that there is recombination sometimes, that some things can happen. So we started working on that. And we realized that by providing these free service to the farmer, it's also super important for us because we can very much monitor what's going on and if there's an outbreak, and for example, which virus is the one affecting.
So I have a question. I'm really curious to know about the idea to develop the rapid field diagnostic tool for the EHD and BT. So could you walk us through that process and how these tools in the future would help farmers or producers on the field?
Yes. So you mentioned 2 diseases. So for our audience, epizootic hemorrhagic disease and bluetongue disease are 2 viral diseases that are very similar in terms of they are both orbiviruses, so they're viruses, and they both produce hemorrhage in the animal. And they are both vector-borne transmitted, so they're transmitted through a vector, which are these culicoids, so these tiny flies, sand flies, specific species of them. Those viruses kill a lot of deer. One thing that's very important is always when we see an animal that's sick, that's showing lesions or hemorrhage, for example, in this case, you always want to make sure that you have a test where you can confirm it. The sooner you can confirm a disease, the fastest you can act, right? So since these diseases are generally very deadly, in my case, we normally will test or sample dead deer. There are also times when some animals are sick and showing symptoms. We can also sample blood. And like I said, the sooner we have the results, the sooner we can treat the animal if it's alive. If the animal was already dead, even if we know it's positive, we already know that, we can take measurement or suggest measurements of moving the animals or getting ready to treat other animals. I mean, there's lots of different strategies. So in terms of diagnostics, we already have diagnostics. Generally, it's through molecular. So through DNA, we will extract the DNA of, well, in this case, they are RNA viruses. We will extract the RNA, run a test, and tell the farmer. Generally, our director, Dr. Wisely, is the one that manages that lab for testing them. And they are really good in getting results in 24 to 48 hours for epizootic hemorrhagic disease or bluetongue. One of the things I really want, and we have been thinking of and working on, is a fast field test. So something that can be run right there in the field with a live animal or with a dead animal, depending if it's blood, serum, or tissue, depending on what type of tissue. But that will be even better because, like I said, the sooner you know and you can confirm a disease, the fastest you can act. So it's always easy to think about, okay, we need this sample, we need these tests. Now, bringing it to life and making it work, it's a lot harder. So we're working on that. There are different approaches that we're taking to try to reach a fast field test. It could be through some type of ELISA, so that will be looking at the antigens, for example, if the virus is present, but it's very tricky, or directly taking advantage of the advance of sequencing molecular techniques that can now be done in the field in much faster ways. So we're still working on that, but that would be the ideal.
Yeah, sounds like a very good idea, and it's going to help a lot on management terms and also prevention of the disease for the all herd, not just one individual deer.
Yes.
So I'm curious to know what is the importance of the surveillance?
So like I said, the surveillance help us understand what's happening in the herds of animals throughout the year, right? So through the surveillance and through the service that we provide, and by the way, I have to make this very clear for any deer farmer or person that has deer there. The Cervidae Health Research Initiative is completely confidential. So even though we're talking in very general terms about Florida and diseases, the data that we obtain from each farm, it's always confidential. That's very important. So going back to the answer, through surveillance, we are able to know when diseases show up. So now, for example, through all the surveillance and the sampling that we have done, we know exactly that EHD, epizootic hemorrhagic disease season, starts in late August and generally ends around mid-November. That's the season where you can expect it. Before we didn't know that exactly. So the farmer knows that that's the time of year that they have to be vigilant, that they need to have the work ahead with their veterinarians and have a good stock of medicine already and work directly with them to treat them, right? So that's one advantage. The other advantage is that by doing surveillance, you can monitor the diseases. So let's say for us, it's not unusual to certain years see new serotypes coming in. So like I said, for example, epizootic hemorrhagic disease have 3 serotypes, 1, 2, and 6. Serotype 2 and 6 are the most common ones. We generally don't see serotype 1 very often, but when we do see it, it's an outbreak because it affects the animals differently. So by surveillance, you can track that and know what's going on every year so that you can be prepared or the producers can be prepared.
And the surveillance you're doing is mostly on dead animals, right?
Yes.
You're tracking, and people would say, well, if it's dead, what it matters anymore? It's already dead, right? What's the impact of the work you're doing now for the farmers? That what can they do with that information now?
Well, yes, you're right. So once an animal is dead, that animal is dead.
Nothing to
There's
do.
nothing to do, right? But if you can take advantage of that and you can use that animal to better understand what's affecting your farm, that's where that animal gets very valuable. Because in time, tell me, I mean, as a cattle producers, you have cattle, calves dying every year. If you just let them know, okay, that calf died, that's it, right? But if you start, being able to research and see exactly what's killing that calf, in time, you, like I said, will be prepared. So one of the things that I believe through this service, other than monitoring, tracking, identifying diseases, is that we work with farmers. And in time, the data we provide them really helps guide their health, their herd health. Why? Because there are farms that have certain types of bacteria problems that other farms don't. There are farms that have seasonal outbreaks that other farms don't. So in time, by working with them and looking at those dead animals, as a farmer, you actually can improve and guide your herd health. And that's really important, not just for deer farmers, but for producers, cattle producers, any producer.
Again, curious to know, for example, in a case when you have an early detection in one specific farm, before the animal is dead, what are some steps that you take, you and your team, to that farm in order to prevent, to not get infected?
Yes, there are several things. Like I said, one of the things is before anything happens, we always let them know that these are the seasons where you have to be prepared, right? If there's a case of an animal that dies from the disease, if possible, we suggest that they separate the animal. That may work. In deer farming is really difficult. Working with deer is not like working with any regular livestock. It's not like a horse where you will say, okay, move the horse to another. You just go in and grab it and move it to the other pen, right? With deer, it's very difficult. That's one thing. You can move the animal. You can separate other animals. You can spray. So there's very different strategies that you can use, since, like, especially if it was a vector-borne, like epizootic hemorrhagic disease or bluetongue, and you're in the season, let's say early fall. One thing that you can do is you can spray or fog so that you kill the vector. Right? So one thing that we always tell the producer is that if you had an animal that died, it's very likely that other animals are maybe already, circulating the virus. If they're circulating the virus, every time a vector takes a blood meal, it can spread it. So if you can cut that cycle of the vector, that's something that will be very advantageable.
I know Miranda is very keen on this topic of One Health. We also interviewed Dr. Lednitzky recently and talk about that. But how does this fit into the platform that we've been working with about One Health?
Well, as long as, the more surveillance, the more sampling that you do, the better. We don't focus specifically on zoonotic diseases. White-tailed deer, really, here in Florida, there's no specific, very dangerous, common zoonotic disease that they carry. They're free of, most of for example, Brucella abortus. It's a bacteria that's zoonotic. It's a big problem in elk population in Yellowstone, in that area, right? Because it can be passed to the cattle and it can be passed to humans as well. We don't have that problem here in Florida. We're always on the lookout, right? We always have to be, careful and vigilant. But what I want to say is that if you are serving animals, it's always important to keep the One Health, the human perspective in, because we never know what we're going to find, and exactly the more you monitor, the better. So I think that's one. We do find sometimes bacteria that E. coli, right? Everybody knows that, if you're drinking some water and it's contaminated with E. coli, you can get sick, right? So, there's lots of things that we can monitor, but we're not really focused too much on the human part, because it depends on what the One Health approach is, right? What the problem is. Is it a virus disease that affecting humans and that can have animal vectors, or depending on what you're looking to? I don't know if I answered your question, kind of.
Yeah, so when it comes to humans, you mentioned that you're not focusing on human health too, but based on my information, your research also looks at how land use and environmental changes affect the disease risk. So could you inform us how factors like habitat or human activities might increase the risks for deer farms?
Specifically for these two viral diseases, right?
Mm-hmm. EHD and BT.
If the habitat is transformed, it could be beneficial or less beneficial for the vectors. So that's one way for sure. And we always know that every time, for example, a forest, a very ancient, old forest, normally you assume that everything had time to be in balance, right? So there's the insects, the animal, humans maybe also they're in balance. So every time we have drastic transformation, we never really don't know what the ecological effects will be in long term, right? Sometimes even in short terms. We can estimate them as ecologists. That's what ecologists and biologists do. Mm-hmm. They estimate those things to minimize them. But really, every day we're still learning in terms of disease ecology, for example. Sometimes just by changing something, it makes it more likely for it to show up, right? Or if, let's say, you had a forest and then you have this population moving in, it's more likely to be exposed something that's being displaced from the forest or perfect habitat. So like I said, that's one of the things that really interests me, and I think it's that we're looking into as well.
Yeah, I would think it would be important to identify these hotspots of the risk of disease.
Yes.
So our conversation here has been focused on captive deer, which is the focus of the work that CHeRI developed. But a lot of people in Florida that interact with wildlife are most likely to be on the hunting side. And regardless, the native animals, the free-ranging animals will at some point have interaction with the environment that can increase the help of disease. They can increase the risk of disease. How does that continuum between the wild and the captive happens there, and where does your role intersects?
Yes, so the white-tailed deer is the same species. That is the white-tailed deer that's produced in deer farms or the white-tailed deer that's out here in Florida. Same species, different genetics. The farm deer grow a little bit bigger antlers, faster, it's aimed to that. But in terms of diseases, both of them can be susceptible to the same diseases. The difference is we focus mostly on farm deers and not too much on wild deer, but we have done some work on parasites, for example, on wild deer, comparing the different types of parasites between wild and farm deer. But also, one of the advantages and the problems working with wild deer is that the advantage is that wild deer are not confined to a pen. So let's say it's late summer, there's a million mosquitoes and sandflies. The wild deer can move to an area where it's, more windy or something where there's less forest, it's less mosquitoes. Farm deer can't, right? They're trapped there, so you have to, or fog, or take care. So what I want to say with that is that generally, since the population of wild deer is even also more spread out, it's bigger. Also, the percentage of animals that get infected it's diluted, so you will see less of it. On the other hand, that doesn't mean, and sometimes we think that wild deer, they're resistant to everything. They never die. That's not true. They do get sick and they do die. And generally, if it's a wild animal, that animal will not search an open spot or a road and die. When an animal feels itself, especially if it's a prey animal like deer are, they will go to the deepest part of the swamp or a thick forest to die. So sometimes we just don't see them, right? The same things with fawns, for example. Now it's fawn season, and you will see fawns that die, but in hours they're gone through the vultures, and that other predators take them. So we're working with both. The diseases can affect both, but like I said, in wild deer, it's much more diluted, right? Because they're also spread out, so the chance of being transmitted is less. But one of the things that we're very proud in CHeRI is that through our work, we were able to work with vaccine producing companies and have a vaccine for epizootic hemorrhagic disease for the serotype 2 and 6. That we have tested it and farmers have used it, and we have seen really good results with that vaccine. That being said, since you asked about wild deer, well, in the future now white-tailed deer is not in danger, but let's say you do have a population that's in danger. For example, the key deer. Have you ever heard of the key deer? Yeah. Well, there's estimated around 700 key deer. So let's say there's an epizootic hemorrhagic disease outbreak in key deer. You can probably use that vaccine. It will be a little bit challenging to dart them with a vaccine or trap them to give them the vaccine, but you have a tool. So our work can also be extrapolated and can be used for the wild population.
Interesting. You're not sampling wild population in most cases, right?
We actually, right now, I do have a master's student that's sampling wild.
I have another question for a new farmer. For example, if a new farmer asks you how to prepare for this kind of disease, how to prevent them, all these challenges, what would be your top of advice to give it to a new producer?
Well, it's it's not one thing. There's many, many different factors. So starting from the layout of the facilities, so the pens, you can have one pen in a few deers, you're already a deer farmer, right? But so that also depends on the scale that the person is looking into, right? What type of manage that person would like to do and is ready to do, right? Some people just want to have them because they're really nice and kind of let everything to the deer, right? Have a couple does, a buck, let it to them. Other people are want to improve their genetics, for example. In that case, you have to have more than one pen and separate the animals. There's management that needs to be involved. So one thing I would suggest for sure is reaching out to deer farmer associations if they have questions of management and things, how to do things. So I work a lot as a veterinarian, work a lot with disease, management, but the everyday cost and details of a deer farmer, I don't manage that. I don't know that, right? So that's when, if it's a new farmer, probably reaching out to the Southeast Trophy Deer Association here in Florida. There's the North American Deer Association, where you can reach out, they can reach out and get information about detailed things. But in terms of health, like I said, one thing that's always important is if they reach out to us, we already probably know what's in that area, and that region, that county, right? So we can guide them and say, hey, we've seen lots of these things or these diseases or these problems in these counties or in this area. So you should probably prepare this and that, right? And then, like I said, work with management of the animals. That's super important. Like I said, working with deer, and whoever's going to start needs to know that it's not like regular livestock, where you're going to say, oh, let's produce some goats. You just bring them, real easy. With deer, you have to take in consideration the size of the pen, the regulations for the high fences, right? So deer farming is controlled by the Department of Fish and Wildlife, the Fish and Wildlife Commission, and Department of Agriculture. So they have to, make sure to follow all the regulations for those two institutions. And then when you bring your deer, you want to make sure how you're going to manage them. If they're does, you want to make sure they're kind of all in the same age, because if they're different ages, they're different hierarchy. So that can bring to trouble. If you have a bunch of bucks, when you start getting into their reproductive season, the rut, their antlers are going to be really sharp and big, and their testosterone is going to be super high. So you're going to have them fighting all day and killing each other. So there's lots of management as well. And then when you're working with deer, you have to be careful about who comes in, the noises, the smell. Lots of different things that you don't think about if you're producing other types of animals. Deer farming is unique, but I think it's an incredible way to produce these animals.
And in general, regarding the disease outbreaks across Florida, can you tell us, based on your experience, do you see differences between north and south of Florida?
Yes.
Differences in disease also, but also the number, if it's different?
In terms of number, not that much. But yes, there are, for example, let's just say directly to orvivirus, so the epizootic hemorrhagic disease and bluetongue, which are very close. They're very similar. Bluetongue, we can see cases almost year-round in South Florida, when we don't see it up north in the winter, for example, in the Panhandle, other areas. It's very, very rare in the Panhandle unless it's a really hot winter. So climate will guide what you see and what you don't. There are certain types of bacteria that are more common in the south, where it's more hot and humid for a longer period of time. What type of bacteria infections that you will see up north near Georgia, where you get frost and when, it's a little bit cooler. So yes, there is different terms. Same thing with parasites, right?
Yeah,
there are certain parasites that, depending on the climate of Florida, it's different. Like I said, some of these diseases are vector-borne, so it's directly related to the ecosystem for that vector and temperatures. That's why talking about climate change is very important, because that can change where certain diseases can show up in the future. And it's actually not unusual for us to see outbreak of diseases after big storms or hurricanes, because all these insects, everything gets shifted and moved to certain other very far places, even up north. Not just in Florida. After big hurricanes, they generally follow up and they go up North Carolina, all that area. They will have outbreaks in their wild population, in the wild deer populations.
Yeah, after the hurricane, there are a lot of research, especially here in Florida, that they impact the environmental niche, also for the carnivores and all, but it's supposed to be the same for the parasites too.
Yeah, parasites, vectors, everything.
So, because my next question is how people can engage with CHeRI.
Yes, so the CHeRI, Cervidae Health Research Initiative, has a phone number that I have to be honest, I remember from the top of my head, but I'm sure we will be able to.
We'll put that info in the description of the podcast.
I should down, but yes, people can reach out. We have a we call it the deer phone, where anybody can call if they have a dead deer, and we will be in touch with them. And if it's a deer that's in a farm, we will reach out and carry out a necropsy. If it's a deer that was hit on the road, or it's somewhere, if it's a wild deer that's dead, generally the Florida Fish and Wildlife Commission is the one that has the right, and they are in charge of sampling those animals. So they have a program where they sample those animals for their own surveillance of diseases.
Perfect. So, in short, if you see a deer dead on the road, don't call you. That's
Fish and
wildlife. But if you have a deer in the wild, or that's ideal farm deer that has died for unknown reasons, that's when.
Yeah. They can give us a call. The sooner, the better, because the fresher the animal is, the more likely we are to identify what killed it.
Juan, anything else we forgot talking about here that's important for us to share with our listeners?
No, not really. First, I mean, thank you so much for inviting me. If you call me again, I'll be glad to be here. No problem. It's always good to talk about this. Since you said this podcast is really aimed, not just, I work with deer farmers, but I mean, most of them are producers and they have other livestock as well. One thing that I will like, I think a very important topic that you touched was why, if you have a dead animal, it's important to know what killed it or what's going on. So I think that applies for anybody that has livestock, especially cattle, goats, sheep, right? We remember, if we have sheep, there's lots of parasite problems with producing sheep and goats. If you can have somebody, collect samples and tell you this is the parasite that's affecting or this is the bacteria, this is seed, in time, you'll have a really good idea of what's going on in your farm, and you can fine-tune with your veterinarian and your workers your herd health. I think that's and that applies for deer, cattle, sheep, goat, horse, anything.
Dr. Campos, appreciate you participating today. Thanks for co-hosting this episode with me. And yeah, we'll have future opportunities to discuss. We still have to talk about parasites. Sure, be talking about nutrition, and there's a lot more we need to discuss in this deer production world here. For those that want more information, take a look at the description of this podcast for the links for the Cervidae Health Research Initiative, and also for the deer hotline. You can contact us if there is any information. You can contact us if there is any dead deer, of course, that's not by injury, but that is suspected of disease.
So the number is the 352-562 3337, or it could be 352-562 deer.
Thank you.
Very simple to remember. Thanks a lot, and thanks for those listening to us in this episode of the Cow Talks podcast. Until the next time, thank you.
Thank you.
Thank you for joining us on this Cow Talks podcast. We hope you have enjoyed this conversation.
If you have any questions, ideas, follow-ups, or comments, please reach out to us through our email, forages@ifas.ufl.edu. That is forages@ifas.ufl.edu. Or find us on our social media, uf.forages on Instagram, UF Forage Team on Facebook, or UF IFAS Forages on YouTube. Cow Talk Podcast was brought to you by the University of Florida Forage Team with technical support from the University of Florida College of Agriculture and Life Sciences Faculty Instructional Resource and Support Team. This episode was produced by Marcela Valal, Olivia Maule, and Ashley Kanabrowski.